Hello and welcome to the Edutalks series hosted by Biotone Edu Partner Program and massage industry experts. As we move through the challenges massage schools, students, and practicing therapists have faced during COVID, the Edutalks series hosted by Biotone, now celebrating 2 years, continues to support virtual learning and building massage community by connecting you with industry experts who share their knowledge and expertise, not only for class discussion, but career success. Tonight's expert is Anita Shannon, who began her career in cosmetology and massage in the 1980s. She's an educator and the founding director of Ace Massage Cupping and Metacupping. She's published numerous industry articles and comprehensive educational videos on vacuum manual therapies, and was featured on the cover of Massage Magazine in 2018 and inducted into the Massage Therapy Hall of Fame in 2011. Let's listen and learn as Anita shares effective body contouring using vacuum therapy. She'll discuss how to eliminate solid bloat using vacuum cups and lymphatic, this is a new word for me today, liquefaction techniques to assist the body in dropping inches by stimulating movement of congested lymph. She'll discuss evaluation, customized protocols, creating a series of treatments, self-care techniques, and client aftercare benefits. Phew. All right, welcome, Anita. Thank you for joining us. Looking forward to hearing your talk. I'm going to exit the screen and turn it over to you.
Well, thanks so much, Donnell, and thanks to you and Biotone for such a great opportunity. This is just such a neat program, and people really get to be exposed to a lot of different industry professionals. It's just really cool. Thank you so much. Yes, we are here to talk about body contouring and solid bloat using vacuum therapy. And it can be done quite a few different ways. We've got 2 handouts for you that will be sent to you. This is one of them. And then we've got an article that was printed in Massage Magazine. So we'll be sending that to you too. A half hour is not enough time to really go into everything we would love to do. So we figured supplementing it with great handouts would be helpful. So the first thing to talk about is solid bloat. People really like that term. It really does describe what most of us have going on. Just personally, just some hormonal fluctuations lately. I blew up 8 pounds in 3 weeks. It's all solid bloat. It's all lymph, fluids, things like that. If we don't find a way to relieve the body of solid bloat, it just accumulates. Because solid bloat is lymph that has just thickened up. It's gotten thick and dehydrated. It feels like wet cement on some people when it's been there for a long time, but it feels like a very solid gel. It feels different from fat. Now, if we can get 10 to 12 inches off somebody, it's solid bloat. Usually we can't move fat like that. That takes liposuction and all different procedures like that. But I think a lot of people are getting those procedures and don't realize it's old lymph. There could be restrictions. Let's say you're somebody who's had a C-section, and all of a sudden later in life, you find you're getting what they call a fupa, which is that lovely little belly flap. Most of that really is because that C-section scar cut off the drainage or most of the lymphatic drainage down to the upper inguinal area. So if we can remove the restriction, that's going to allow the lymph to flow, but we still have to find a way to liquefy that solidified bloat. The other thing can be just plain old dehydration. Let's say you're somebody with a heavily inflamed colon and certain organs. Yeah, you probably also will be the victim of the dreaded FUPA, which it makes life uncomfortable, makes it hard to bend over for a lot of us. It makes it difficult to wear certain clothing. It just makes life very uncomfortable. But to be honest, on top of that, it really is not healthy for us to be carrying that extra weight around in fluids. Solid bloat can be also from restrictive clothing. There's all kinds of things where you'll see marks on people where they used to wear Spanx and all these wonderful restrictive garments that we've got, because we're trying to compress our solid bloat instead of getting rid of it. So it's time for us just to get that solid bloat off of there in a healthy way for the body. So this is a term that I love very much, that we use for this. And I know it was a little difficult for Donnell to a lot of people have had difficulty with the term, but in geology, when you've got solid rock and you've got a vibration, let's say from an earthquake, you can also mechanically produce that. When the ground liquefies and moves, as you've seen that in earthquakes, you've seen solid rock all of a sudden become liquid. It's called liquefaction. And I just thought that was a really appropriate term to use for solid bloat. When we use the body heat, when we bring heat from deeper in the body up into that area, which the cups do just by vasodilation, you're bringing the heat up from deeper tissue. As the blood vessels dilate, that is one of the body's mechanisms for eliminating excess heat. If you've got somebody with such a high amount of solid bloat that it stays cold and you really can't get it to warm up and liquefy, that's where you're going to want to do a pre-application of heat. So when I'm working with very large people who are going to have bariatric surgeries, things like that, and Donnell, thank you so much for following all my ramblings and moving the notes. Very often I find I will do a topical application of moist heat, seems to work the best, or you can put them in a far infrared or near infrared cabinet or room, or we've got so many different tools now. And if you do have people working at home on themselves, which when somebody's working with me to reduce the inches, things like that, especially pre-bariatric surgery, they're going to have to be working at home in the shower. So when they get in the shower, nice warm water, hot water starts liquefying the lymph, and we show them how to work with a silicone cup in the shower. And they can only do that twice a week, maximum of 3 times a week. Again, the key is what I said earlier, is eliminating solid bloat safely. So we don't want to overload their body. We don't want to move all of that solidified lymph right over the lymph nodes. So now they become congested. You know, with most people, they see such a difference even after the first treatment. They're okay with me explaining to them that this is not an event. It is a process. It took them a while to accumulate the bloat. It's going to take us a little bit to get it off. But once we get all of that off, that's the neat thing. Once we've helped their body eliminate 20, 30 years of bloat, it's not going to come back. They're going to have to actually recreate. It may take them another 10, 20 years to get back where they were unless they make lifestyle changes. The biggest thing is just leaving them with that most powerful tool, which is their silicone cup for their shower. Makes a big difference. So not only are we liquefying the old lymph that has thickened and dehydrated, we're moving it through the body to be eliminated, but we're also bringing blood flow and wonderful things into the area that's been so congested. There's been very little nutrition able to get through that congestion. So it really, it's more than aesthetics. This is something that is health oriented. And it just makes people feel better when you don't have an extra 10 to 15 pounds of solid bloat hanging on you. Some people it's 50, 60 pounds. You might want to get out and walk. You might want to get out and do some things. You feel more energy. The bloat does kind of bring us down. I hate to say it, but as you're working on people, you may also find weird smells and stuff coming out of them. There may be old things trapped in that lymph, and you might get a little whiff of that every once in a while. But it does help give the body a little bit of a kickstart. Again, incredibly valuable for people who are going for bariatric work or any kind of other surgeries, any kind of liposuctions, things like that. Because if we can get all that bloat off of there first, and the doctors then get to remove actual fat, or in case of bariatric surgery, if somebody can drop 50, 60 pounds off of their 300-400 pounds prior to surgery, get that lymph off of there, they're going to have a much better chance in surgery of their heart making it through, of being a lot less strain on their body. The doctors are real happy with the prep work we've done, and it's fascinating. It really is, especially when these people see pounds melting off and realize that it wasn't all fat. You know, the less active we get, the more the bloat's going to come on. Sitting in front of a computer, different things, lifestyle stuff is going to contribute to that. Oh, important items to remember. Oh, wow. I did forget one thing. I just had to touch back on those notes. Vascular surgeries. That's a really big one. If we can get to somebody and drain the solid bloat and all of the congestion out of their legs before they go in for vascular surgeries, it's amazing. The pressure on the vessels is decreased. We have had a few doctors cancel their patients' surgeries after we got done with them because the vascular issues resolved themselves once we eliminated that large amount of fluid in their legs. That's going to be pretty rare, and I would never tell anybody that. I just want to prepare them for surgery. But thank you for scrolling down on that. I forgot about that little part. And again, there is one right above that that talks about autoimmune disorders. People with autoimmune disorders tend to be inflamed, and that is one of the precursors to solid bloat. Once we get inflamed, we become dehydrated. It just kind of goes along. We go into that acidic tissue condition, and everything just gets kind of unhealthy. So please, anybody who has autoimmune issues, anything from rheumatoid arthritis to Epstein-Barr issues, chronic fatigue, immune deficiency, all of that, fibromyalgia. The nicest thing is we can work either a little deeper, or we can stay extremely superficial in our treatments on people. So if you were going for heavier applications, you're going to go for a longer pumping movement. In the lymphatic work I do, I tend to stay between like a 1 and a 10 on our machines. That would be a light to moderate suction, depending on, am I trying to move a restriction? Am I trying to move solid bloat? You can also mimic, if you do lymphatic drainage, you can mimic those feather-like movements with super big cups and pumping movements. So now, instead of me using my fingers, I actually am using a really large cup, barely stimulating the skin up into the cup, but enough that I'm going to open those termination flaps on the system in the body, lymphatic system, the terminations in our skin. And just, it's such a stimulation to that it really does reverberate much deeper into the system and do exactly what our goal is with the manual therapy. It's just, I can complete a body in about 45 minutes to an hour, where with my hands, it was taking me a lot longer, and I had to do sections only, unless somebody was willing to stay on my table for a really long time. So whatever your base of knowledge is, especially in lymphatic work, you can use the machines or even manual cups to mimic it. I find it's easier with the machine to get that super light 0.01 suction strength that I want. That's really hard for me to get with the manual stuff. But so you can stay very superficial, or you can go a little bit deeper and get between the dermis and the epidermis and really move this solidified lymph in any direction that you want. So people have had a lot of questions about my drainage pathways. We'll go over those in a few minutes. I want to finish this handout out first. Don't think there's, the biggest thing is, if you want to spread it out, use a really big cup, which I like. That helps me to get a softer suction strength on somebody. But if you haven't worked with cups before, definitely either take an online class, take a live class, anything, just so you have instruction in how to use the equipment, and then start going into the vacuum work. This is something we used to teach in our classes, the Vacuum Therapies Body Cocoon, and I decided to include that in the handouts. To me, this is one of the best treatments I've ever taught. But for some reason, people kind of thought, well, it's spa. It's not. This is lymphatic drainage. What we did with this, though, is we added more synergistic tools. So not only do we have the vacuum therapies, but we added product. So you could apply your favorite kind of cellulite product or lymphatic drainage aid, whatever you would like. We did aromatherapy, and that's just a personal love of mine because I've been doing that since the 80s also. So we did actually include the blends in here. These are our older blends. We're thinking about redeveloping these. We've talked to, was it Botanically Rooted, about redoing these blends, just because we've come across some brand new safety that we think that maybe the basal might be a little high. We've never had any issues with anybody, but just we kind of like to keep up with the times. But we did give you the setup of it. And basically all you're doing, you don't even have to do the setup like this. If you want to do lymphatic drainage and just keep a person covered with a blanket, that's all you have to do. Because the key to this is, once we get the area nice and warmed up, liquefaction's going, and the lymph is moving, we want to put our essential oils or other product on there because it's going to absorb the most. And then we want to cover it and keep the area warm. So we don't want to turn like a table heater on, because we don't want them sweating, because we're trying to penetrate stuff. But we want to keep them nice and roasty in there, where they're not sweating, but their skin still stays nice and pink. The longer they stay warm like that, the more they're going to drain, because you just allowed that to stay liquefied. So let's say they're on the table with me for 45 minutes to an hour. That area I started with had 45 minutes to an hour to just keep draining and draining and draining. So very often I do start on the belly and really do start on the lymph node beds with a lot of people, especially if they're very congested in the abdominal area. So you can do this just like these treatment steps, or you could just have somebody. You don't have to have the plastic sheeting. You don't have to have anything. Just make sure you cover them with a blanket after you're finished with each section. Of course, a sheet first, then the blanket. It's as simple as that. You don't have to do what I call the burrito wrap, because basically you're not wrapping these people. You're just bringing the blanket around them like a big burrito. If you didn't have it underneath them, all you do is make sure you keep covering each area right after you finished working. So it's a super easy treatment. It's in our online courses and videos. I still teach a modified version of it. We stopped using the essential oils just because people in class, there's always going to be one person that does have a sensitivity, and I don't want to do that to them. So this is lymphatic drainage. So when we teach this in class, I'm teaching lymphatic drainage pathways. Well, let's switch over to the other handout, just so I can explain to you some of the differences. So this is going to be the metacupping drainage pathways. You'll get that tomorrow. And it's got different bodies on it. And Donnell, whenever you have a chance, if we could switch to the metacupping drainage pathways, that would be awesome. Awesome, there it is. Okay, you're gonna see on these different, this is really important, vacuum mobilization drainage. This is intermediate lymphatic pathways. So any of you who do superficial, you're going to look at this and say, what did she do? Very simple. When I first started this, I did the same pathways as the superficial work that I was taught in manual lymphatic drainage, because the vacuum drainage moves so much more material. I overloaded people's lymph nodes. I made some messes. I really, really did. So I finally figured out, if I'm going to go deeper and going to go into the intermediate, I had to change the drainage pathways, like split the leg anterior and posterior. I can't bring it all to the lower inguinals, or they're going to end up with swollen node beds there. So you see with that person with their back to you, we have split the posterior leg. All roads lead to the nodes. So if I'm starting on somebody on the back, everything is getting dropped to the side of the body. With the legs, it's getting dropped medial and lateral. The lower leg is basically being washed up into the upper leg after we've cleared the upper leg. Now, there's been questions in manual lymphatic drainage. If you lose contact, you've got to go back to your origin and start again. With vacuum therapy, and this is a challenge for a lot of people with vacuum therapy, we don't have to do that. So when I drop all of this stuff on that person's right side when they're laying prone, when I turn them over, I go to that right side and I start moving what I dropped there. It has started doing a backflow. And that's the reason in manual lymphatic drainage, we have to go back to the starting point. But because I'm using suction, when I put that cup on there and the suction hits, any backflow then gets pulled back towards the cup again. So it's really cool. It really has eliminated a lot of issues for us. You know, we can go to that second one. So this is the coach, the anterior. And we'll just keep going. There you go. And you will notice the breasts, you know, again, we did that because, you know, we work on men too, and we want to work that area. But if you haven't heard already, we love doing breast work. We actually have a breast institute in about a week that we're doing in Ohio. So the breast work is amazing. And again, we have to understand lymphatic drainage to be able to do the breast work. So you'll see here, everything looks pretty normal on the anterior with the leg. You will see everything does go through to the lower inguinals, but a lot of the posterior I brought up, and you'll see coming up above the arc of the hip and into the upper inguinals. We did a side view too. I think it's one of the last ones, just so you can see what it is from the side. Now, the next one here is superficial drainage pathways. So if you would prefer to stay with the super feather light pumping, these are the directions you're going to go. So it's a little bit different. and it is going to, along with the more traditional drainage pathways. So if somebody is really, really, really congested, I might start their first one or two treatments doing more superficial work. And then as we get going, as I get into the other treatments, then I can go ahead and go into the deeper between the dermis and epidermis. So our next page is going to be the anterior of the superficial. And then you get to one of the favorites is the next page, face lifting and drainage. Sinus season, when people have sinusitis, colds, allergies, you can't imagine how many people love getting their face drained, and it's a wonderful add-on. Plus, the nice thing is you're stimulating those clavicular nodes and really activating a good portion of the system just when you're working on the face. Any kind of pre-surgery, or any kind of, somebody's going to go get a peel or dermabrasion or anything on their face, injections, please don't do this right after somebody's had injectables in their face. You want to wait a while until after they've had at least 2 to 4 weeks with the injectables in there. But we definitely want to get to them before they get their next shots, to clear out some of, especially Botox. We'd like to clear that out of the tissues and prep the tissues for their next injections. But if you haven't ever had your face sucked, I tell you, it's the best. Now, the next page is our side view. And so we're showing you the drainage pathways. So you'll see how they come up the side of the leg, come up over the hip and down into the upper inguinals, while the other part of the leg, more medial and anterior, will go towards the lower. And this is going to be different than you see with superficial work. But once I explained to everybody why we had to do it this way, that helps a lot. Now, as you're working with people, the cups are showing you stuff. As you're moving the cups over them, you're going to see dents and divots and all kinds of stuff. And we can probably take the handouts down now if you want. That way they got to look at my mug, if that's all right. So as you're moving through people, you're seeing dents and divots. So you're going to see restrictions. You're going to see areas get super hot where you would be able to like cook breakfast on it. All of these things are giving you information. You know, is it inflammation that's there? Yes, you are going to get those visuals. Those are going to come to you in handout form PDF. So Donnell will send those out tomorrow. But the neat thing is the cups give you the information about the person. So I always know what to go for first. If there's a restriction there, why am I going to try and move all that stuff past it? You know, it's not going to go. So I've got to get rid of the restrictions first. So you're going to develop a protocol for each person based on their intake form, and then based on what the cups kind of show you, which is really fun. That's what I like about the cups, is they show me a lot about people. With the lymphatic system, I mentioned that people can only do it at home 2 to 3 times a week maximum. Same with this. We have to give their body 2 days in between so that that lymphatic system can keep draining and keep draining. By the 3rd day, they're ready usually, and we can work on them again. If we go in too early, we just kind of override their whole system. And that's not our goal. What we want to do is enable their system to really start keeping up with the drainage. You know, now we're going to clear 20, 30 years of debris out. We want them to keep up with it. So just remember that as you're building a protocol. And with a lot of people, I don't even let them pay for the full series up front. I tell them, you know, you pay for 9, you get the 10th free. You know, we need you in twice a week, at least for the first 2 weeks. After that, once a week. That's really hard for people. So what I do is I book their first appointment, and it's my usual, is this going to work for you? And if we get really good results, which we usually do, we book their second appointment and book their series. I just like it that way. That way they really understand that I'm really there for them. If this doesn't work, I don't want to do the series either. That's why it's not going to work for them. And it just has some integrity to it. And plus there's something about refusing to sell them the series the first time that people just get a little weird. It's like you're denying them something. It's really funny. But I think that's it. I think I have just vomited an enormous amount of information all over you guys. Do we have any questions?
Hi, I'm back. Yes, we did have questions come in. Teresa asked, I had kidney cancer surgery on my left side 5 years ago. I find more bloat or weight on my right side than before the surgery. Is that common? So the surgery on the left
No, I
and the
know.
bloat on the right.
I heard that. That's a good question. I'm going to ask Martha about that. One of our other educators she works with so many more people post-surgery like that. I've only worked with 1 or 2 people who have, in 30 some years, I've only worked with 1 or 2 people who have had kidney issues. I'm just going to say, I don't know about that. If you wouldn't mind emailing us, and I'm going to pass that on to Martha. I bet she's going to know.
Okay. She had another question along with this. Is there a way to use cups to remove the bloat on oneself?
Oh, yeah. You bet. In my shower, I've got my silicone cup. And right now I'm working furiously trying to get all of that fluid off of me from the hormonal fluctuation I had. And then I do work on my face too, like little silicone cups. And, so I may not do that in the shower. A lot of times I do. It's just easier when you're in the shower because you've got stuff, soaps and things on. Now I got to even it out. But these are really fun. Please don't do this while you're driving or anything. But these are great. So all these little silicone things, yes. The only thing I can't really get to, one of the toughest parts is that, back flap stuff we get. But I usually, just raise my arm up and drain down, bring some into the axilla, and then I bring some past it and down. But if my belly's really big and congested, I may not bring it past and down because then I'm just going to add to my fupa.
And Katie was wondering about getting the visuals and the best direction to drain. And Katie, those will be included in tomorrow's follow-up email. So keep an eye on your in basket for the follow-up with the recording and the handouts. Question, I do visceral manipulation, right-sided fluid buildup is often a stagnant liver, was a comment.
Ooh. That makes sense. How do you relate that to the kidneys? I see the relation. That's interesting.
Or it was to, regarding the liver?
Yeah.
Okay.
Yeah. That's interesting. I still want to pass that by, now I want to pass it by Martha even more and add that comment too.
Okay, and that comment was Jackie.
Thanks, Jackie.
And let's see.
The liver doesn't work and then the kidneys are, I missed that.
Thanks so much. Well, the two different people, two different questions, and it looked like Jackie was adding that comment back to Teresa regarding the kidney question. And she's saying in visceral manipulation, right side fluid buildup is often stagnant liver.
That's really cool. So we'll have to see where the liver stagnation came on. Is it like you were saying first and then the kidneys were affected by it and it was always there? Or since the swelling came after the surgery, did something in that procedure precipitate your liver? That's interesting.
Jackie had another comment here. The liver doesn't work, and then the kidneys are overloaded. And she's a lymph, cranial, and visceral therapist.
Nice. Are you two near each other? She can work on you.
Jackie and Teresa. Clearwater, Florida is Jackie, and I'm not sure where Teresa is from.
She might be a person from Morocco or something. Arizona, darn it.
Oh, she's in Arizona.
Well, I'm
Well,
over in Fort Pierce, Florida, but I do know we do have an educator actually over in near Tampa, Chrissy. But I'm still interested though. I'm going to ask Martha about that, you know, all the feedback on that, about the liver and about the swelling on the right side coming up after the left kidney.
right.
Was it removed or just surgery on it?
That's Teresa. She's the one in Arizona, and hopefully she'll reply to that
Okay.
in chats.
Or we can have a private chat about that. That'd be really cool.
Okay,
But I
because
love these groups because half your left kidney. Okay. When is the next class to be able to get certified? Definitely go to our website. Everybody's listed on there, all the classes. And we're building steam back up after COVID. We pretty much shut down. You know, we only ran a few classes during that year, but now we're back at the shows, back doing classes. So you'll find a nice calendar on there, and it's going to get beefed up quite a bit over the next few months.
And Anita's website information, contact information will be in the follow-up email tomorrow as well. All right, before we wrap up, okay, when is the next class? Did that just come in, to be able to get certified to do the body contouring? Is there any classes that are being offered? Do you have classes being offered in body contouring?
If you've taken our level 1, you've got it in there, but you know what? I'm thinking of doing a live class. That would be really cool.
All
Just
right.
lymphatic work and body contouring. Okay, I want to do that now.
So again, Anita's contact information will be in the follow-up email tomorrow, and feel free to email her with your contact information and that you'd be interested in a body contouring class. And when she gets that together, she can reach out to you. All right. Are there any other questions?
Thank you, Sally.
Yeah, that's a great pat on the back for you. And many thank yous have come in. And let's see, I have another one down here. Okay, so Teresa in Arizona would love that class. So
Yay!
Thank you very much. I feel that in closing, do you have any last bits to say, or going to your website and finding information there, or emailing you would be the best?
Yeah, and thanks for that suggestion. I actually may already have that class approved through the NCBTMB because I used to do one years ago, and then for some reason, I don't know why we stopped. So thanks. I'm going to bring that class back out, and we're going to get it back out there because it was one of my favorites, and I don't think really people appreciate the importance of a clean lymphatic system.
Well, very good. So everyone is thanking you for the information tonight. And it was a great presentation. Body contouring has become very popular in Florida.
Well, yeah,
to everyone.
We don't wear many clothes.
And I mean, dieting wouldn't help. If people interpret it as overweight and, oh, I have to lose weight, the dieting isn't going to help.
Unfortunately, no. Then they get frustrated.
Right, because they're not realizing really what it is. So a lot of education to be done out there. Well, I think that's it, unless there's any last questions. And I don't see any coming in. Just thank yous. Yes, that's a wonderful parting shot. So, all right.
These.
Thank you, everyone, for attending. I'd like to mention our upcoming Edutalks in August. We have Jennifer Pressimone on August 9th, and she'll present on essential oils for hormone, adrenal, and thyroid balance. And that RSVP will be up and open tomorrow. Felicia Brown will join us again August 23rd. Smart startup strategies for new and existing practices. And if you can tuck this away for September, we have a special 1-hour presentation with James Waslowski and Carrie D'Ambrosia on September 13th, clinical reasoning for your practice, total body versus local approach to knee lesions. So we have a great lineup coming, and we'd love to see you all there. All right. Thank you, everyone. Be safe. Thank you, Anita. Great information. And watch your in basket tomorrow. Take care, everyone.
Bye.
Bye.